Pelvic floor health of a woman. Probably not a topic most women think of until there's a need to. So, what are some of the treatment options? Today, we'll talk with Dr. Stephen Karp about some of the advancements. Welcome to Top Docs. I'm Maggie McKay. This is the Top Docs podcast. I'm your host, Maggie McKay. Dr. Karp, thanks for being here. Can you please introduce yourself?
Yeah, sure. My name is Dr. Stephen Karp. I am the practice owner of LaserSkin MedSpa in beautiful Glen Mills, Pennsylvania, which is just outside of Philadelphia and north of Wilmington, Delaware.
Beautiful. So to begin, let's get right to it. What is urinary incontinence and who does this affect?
Well, urinary incontinence, affects, people, men and women, especially as they get older, or if there's some kind of, damage to the nerve region in the pelvic area after some trauma, or, even certain medications may affect that region. But we focus on helping women recover from pelvic floor dysfunction. Pelvic floor dysfunction manifests in several ways. One of the ways is urinary incontinence. So women typically in their 50s and 60s, typically after childbirth, and frequently what happens is, laughing and sneezing causes peeing, dripping, or even exercise induced. We have several women who are CrossFit, and as they're doing activities, they notice leakage, and it's a major problem.
And what is the job of the pelvic floor? How would you even know if it had been weakened as a woman?
Yeah. Well, the pelvic floor's job is to create a foundation for strength across the pelvic region and really supporting the bladder and, all of the connective tissue into the pelvic region. And over time, due to various reasons, the tissue becomes weak, it becomes lax, and very dysfunctional and very unsupportive. And it manifests itself in pain, instability, and things like urinary incontinence for sure.
Let's find out about the good news on this topic. What are the new? There is some good news.
Yeah.
What are the new advancements in women's health?
One of the things that I kind of came up with as I'm sharing it, because these are sensitive topics. This is
Right.
a patient comes in with this kind of concern, and it's a real game changer in their life. They have to use, sometimes they'll have to use, a pad to prevent, dripping into their, into their clothes. And it's especially for some people, it can be kind of a humiliating experience. So
Right.
I came up with a little phrase that says, if you sneeze and pee or don't like what you see, then we can help you with your vaginal rejuvenation needs. As important as it is, for women to help with the internal issues of pelvic dysfunction and urinary incontinence and, pelvic floor strengthening, aesthetically, with radiofrequency skin tightening, that's what we're using here, RF, we can make a huge difference on the aesthetics also. So for women that have a lot of skin laxity or asymmetry, or they don't like what they see, we make a huge difference. And it happens in 20 minutes, and it happens on the table. It's really amazing and immediate.
Is that without surgery?
It's without surgery. Yeah, it's
That's great.
technique. The machine is called the Temperature Vitalia. It's made by Cynosure. It uses technology of radio frequency to superheat the tissue using around 103 to 109 degrees. And that causes a response in the tissue to think the tissue is being damaged. So it creates fresh collagen, fresh elastin. It takes tissue that's very lax, very droopy, and it lifts it, it tightens it, and it brightens it. And it creates a beautiful response. Typically, most patients are going to need between 3 and 5 sessions. The sessions are going to be around 3 weeks apart. And again, you see the changes happen on the table. And I've been in aesthetics, for a long time now. I've owned the practice for several years, and we don't see a lot of immediate responses in most things that we do. In terms of a positive change. I mean, in 20 minutes, to see, tissue that's very lax and very droopy to lift, tighten, and look, have a beautiful response that you can be really proud of. And it helps a lot with, self-esteem issues. So it's as much as it does make changes internally, the external changes are absolutely amazing.
I've heard some women refer to it as a miracle.
It is. And of course, not being as familiar with that, type of tissue, not having that type of tissue myself, men, we have our own issues, right?
Right.
When it comes to the way we look in certain regions of our body, but it's more straightforward for men. For women, it's a lot more complicated because we're not just dealing with pelvic floor issues. We're also dealing with painful intercourse, like interstitial cystitis. We're dealing with issues of dryness and look, at the end of the day, if intercourse is painful for you, you're probably not going to want to have a lot of intercourse. Right. So this is a game changer. You want to have, your love life back. You want to increase your libido. You want to have more sensation, increase blood flow. This is like a blood magnet, right? So we're getting rejuvenating tissue on the outside, we're rejuvenating tissue on the inside. Everything starts to function and work. And I have a testimonial I love to read, if that's okay.
Sure.
This is from Melissa.
Okay.
Now, Melissa is a 52-year-old woman with one child. She's one of our CrossFitters. And when she's exerting, she's dripping. Right. So how embarrassing is that? And how
Not
uncomfortable is that to be exercising and then have, wetness in your shorts? So this is from Melissa. Melissa had 3 sessions, right? Usually it's somewhere between 3 and 5. We found 3 is really a great start. And then some women will want to come back every couple of years for a maintenance session. Mm-hmm. Again, these sessions are 20 minutes.
That's amazing.
And we have a beautiful facility here. Mary Beth is one of my providers that does the vaginal rejuvenation. Mm-hmm. And she's very experienced. She's very kind. She's very gentle. She's had it done herself. So she knows what it feels like. She knows what the results are like. She's done, now 30 or 40 procedures, and the outcomes are great. And Melissa was probably one of our best outcomes because she had 2 issues. Not only did she have the internal issues of dryness, painful intercourse, but she had the aesthetic issue. She had a lot of asymmetry. It looked like a zipper that was going left and right, mm-hmm. right? Instead of, nice symmetrical lines. So she didn't feel confident and she's been married for a long time. Yeah. But she lost her confidence. Right. And so this was a big thing for her. And she sent me this. She actually texted me this recently. She said, I didn't really understand how Vitalia would improve my bladder issues and other gems of menopause. After the first treatment, I noticed I was no longer leaking from a sneeze or laughter. I was also able to hold it better, and my visits to the bathroom were more productive. I'm not just getting a little bits of urine at one time. She said, Vitalia in combination with an estrogen gel has made sex less painful. No one warns women about what happens to their sex life during menopause. Lastly, my cookies look more like a 30-something than a 50-something. and that's really the best part.
I like the gems of menopause part.
The gems of menopause.
Dr. Karp, who would be a candidate for Tempsure Vitalia?
Well, really any woman who has issues with pelvic floor dysfunction, pelvic floor weakness, urinary incontinence, issues like frequent urinary tract infections, low estrogen after, postpartum, vaginal laxity issues, vaginal dryness, and painful intercourse. Those are, and of course, the aesthetics, right? Anybody who just doesn't love what they see. They love what they look like in their 20s and 30s, and now in their 50s and 60s, it's like somebody else's vagina. Well, we can restore that and help them get their confidence back.
I like also what Melissa said. Nobody warns you about whatever it was about menopause. It's
Yeah.
right. You don't know anything until you're in it, right?
You don't-
No one's going to tell you.
you
It's just like
don't.
childbirth, but you can't avoid
Yeah.
it. So if someone's interested in this treatment, I know you talked a little bit about what it entails, but what are the next steps? Like how many times you have to come?
Well, we
Is it
always start with a complimentary consultation, right? We always start with that conversation that, let's get to know people first. Let's find out what your goals are, what your concerns are, because really at the end of the day, LaserSkin MedSpa we stand for rejuvenation. Whether it's skin rejuvenation or vaginal rejuvenation, that's what we do here, right? So we're going to get to know our patients. We're going to find out what their needs are. And then we're going to create a customized plan and journey that meets their needs every step along the way. And then we're going to be there for them to make sure that they're happy, right? So, we're this boutique. We're this little boutique practice, in beautiful Glen Mills, Pennsylvania. And we're finding these mountaintops to shout from that we can help these people with all these issues, right? And so this is the best mountaintop I can think of, right? To create an opportunity to share with our community. We're gonna put this in places, and I really am grateful for the opportunity to sit down and chat with you and for you to get to know us better. But at the end of the day, we're here to help people recover from issues that revolve around, their pelvic floor dysfunctions. There's no surgery. It takes 20 minutes and changes happen on the table.
It's amazing.
When you leave, you will see a major difference. Now, you need about 3 sessions, right? We need about 3 sessions to really strengthen the tissue and to make, changes that are more permanent. Now, the other thing is, people ask me, are these changes permanent? Well, we're still aging, right? Mother Nature is undefeated, right? So she's gonna, we're gonna have some more laxity issues as we get older. We're gonna create, more, our body's gonna age, right? So there may be some necessity for maintenance every year or two coming in for a follow-up session.
Right.
But for what you get out of it, that is a really small consideration.
So if someone would like to find out more or make an appointment with you, where would they go?
Well, we have lots of information on our website at LaserSkinMedSpa.com. And of course, you can always call us here at the Med Spa at 610-886-4980.
Dr. Karp, your passion for helping people is so apparent, and this has been so informative.
I've been practicing for 27 years.
What? You don't like
27 years
I've been doing
this. I love to help people. Listen, it's a passion.
Thank you so much for your time and sharing your expertise and your passion. It's been a pleasure talking with you.
I appreciate it so much. Thanks, Maggie. It was great to get to know you.
You too. Again, we've been talking with Dr. Stephen Karp, owner of LaserSkinMedSpa.com in Pennsylvania. And if you found this podcast helpful, please share it on your social channels and check out our entire podcast library for more topics of interest to you. This is the Top Docs Podcast. I'm Maggie McKay. Thanks for listening.